Rosewood's in Southeast Portland. We've been here for a little over 10 years. The population is very diverse. We have about 20 languages that are spoken in the clinic.
It makes the job very interesting to serve all of those different communities. We also have a lot of patients, they're working and they're unable to afford insurance. We're able to provide them a lot of resources that you would think that they would have and they don't.
We do prenatal services, and we have a lot of integrated supports here. We have integrated dietitians, behavioral health consultants, a social worker, and also a psychiatric nurse practitioner.
Here we're in the waiting room at Rosewood Family Health Center. This is where our expert screening starts with our front office staff. Anybody who's 12 and over gets an expert screening.
We would look and see if a patient were due for an expert. We'll give them a form and we'll ask them to please complete the form honestly, and then they'll take that over from the back.
The other thing we're going to be moving towards in our clinic is going to be screening for social determinants of health. So we want to make sure that we're looking at that in conjunction with trauma.
We started a really large initiative, our patient-centered health home initiative. That was really kind of served as the basis for really kind of expanding the work that we do and really moving into team-based care. One of the things that we're doing as part of our major care transformation initiative is creating some space for our teams to connect outside of patient care.
And we also have team time where the teams of providers, nurse and medical assistants and support staff meet twice a week.
And during our team time, we would be in the back with the provider. We would talk about our referral, do some follow-up. For instance, we need to get a hold of this patient and we couldn't get a hold of them, or they have a question that they need to talk to a provider, or we need to get some insurance verification or approval. Then we would take that to team time for coordinated care.
Not only are we improving access, but I think we're also shifting to the point where the access we're providing is better suited for the patient.
If a patient coming in seeing a provider, they might see an RD at the same day, and also a dietitian, behavioral health, or social worker same day. It's kind of more convenience for our patient to come in same day appointment to see everybody at once than instead of making multiple appointments.
The flags here are very important in terms of our coordination with care. Our yellow flag here in particular is when the BHC is being called for social work, it's all the flags. From the provider, it's a white flag, and for the medical assistant, it's a red flag. Our psychiatric nurse practitioner, it's the blue and the yellow flag. And then dietitian is green. It's something that really helps us kind of understand where each other are at in coordinating, day-to-day workflows. The behavioral health consultants are right next to the medical providers and making sure that we're communicating about patients constantly throughout the day. If you're going to be a part of care delivery and primary care, there's nothing more important than really just being present in the same space. The behavioral health consultant is a cog in a really large wheel or a large continuum of behavioral health integration. Integration starts in primary care, goes into specialty care, and eventually kind of goes into more of an inpatient perspective. We have a variety of outlets for our behavioral health consultants. We have meetings monthly. We have a drop-in consultation hour. We use a platform called Yammer, and we have a skill building piece that we do every month.
Patients really appreciate that we have somebody to come see them from behavioral health when they're here in the clinic. I really do believe that where we're moving to is a much more seamless, efficient way to take care of our patients.
Usually we meet patients from a visit duration anywhere from 5 minutes, whether it's meeting them at a well visit, really just introducing our services, normalizing the context of care, all the way to a 30-minute visit when you have a pretty complex case. We may need to see them 3 times in the same week. Sometimes we might need to see them once a month. But typically we see patients anywhere from 1 to 3 visits, with the modal number of visits probably 1. So it really just depends on the situation. The important thing to remember about behavioral health consultation is the flexibility is what sets the model apart.
Really, the clinic's model is to meet the patient's needs, whatever that is, and everyone's really passionate about it.
This job has had such a huge impact on me professionally in so many ways. I feel like it's made me a stronger leader.
I'm fortunate that we have a group of providers and a group of clinic staff members who are really excited about doing things a little bit differently.
I will never practice primary care in a place that does not have behavioral health support. It really is practice changing. I hope that more practices really can integrate and see what a vital piece it is for their patients' health.